So, Sophie, it's lovely to talk with you. And you were telling me a little bit about a case, a feline case that you were talking about. Please give us a little bit of background as to more information about the case.
Yeah, so I saw recently a 12-year-old female neutered cat in for her annual vaccinations. And the owner was reporting that she had been a bit hungry in the past couple of months, and when weighing her I noticed that she'd lost about 400 grams since the year before. So I recommended some blood tests, as she was an older cat, to check her renal values and her thyroid values, and also to check other electrolytes and hematology as well, just as a full geriatric screen. So I took those bloods, and then the next day the blood results came back, and she came back hypothyroid. Her total T4 was about 70, so it showed she had hypothyroidism, and she had a mild azotemia. So I also recommended a urine sample on this cat as well, so the owner was able to get that at home. When going through what hypothyroidism meant and the different treatment options, the owner was quite interested in understanding more about the disease and the kind of pros and cons with all the different treatment options. And just as a phone call, it is quite overwhelming to explain everything to them.
Yeah.
So I tried my best, but I also discussed sending over a info sheet from Vetlexicon, which she found very helpful. So shall I show?
Yes, do. Yeah, let's start with the Felis page. So if you go, so
you can type in hyper, and it will eventually come up as you're typing it. So there's the one here.
Yep.
And then this is the page.
So let's go. Let's just see what the issues were that you were thinking about with it. So what you were talking about, the lab tests. So let's go down to the diagnosis bit.
Here's the diagnostics. So here we've got weight loss and polyphagia. She didn't report any vomiting or diarrhea. The cat was otherwise quite well, I think. So those were the kind of the main signs that she was fitting in with. But as the weight loss was quite kind of prominent, I guess it was good to, you don't want to ignore that amount of weight in an older cat.
Down to the test that you were running and what was helpful with the case.
I did a full, you can do what's called a geriatric screen if you use IDEX, which is a very good screen. So they do a full hematology, red blood cells and white blood cells, and then they do a biochemistry. So they do all the kidney markers. They also do electrolytes, which is always helpful. And they do phosphorus, and they do total T4 as well, all together in a bundle. So it covers a lot of things. So you can see here, you can sometimes see changes in the biochemistry. But if you scroll down, it's got more information about the different thyroid tests. Because if it does come back with a grey area of the total T4, then you can look at doing free T4 result tests as well, which are explained here.
Yeah. Good. And so once you got the tests back, you were then saying that you were talking with the client who wasn't with you. This was on the phone, was it?
Yes, this was all on the phone. So when you're explaining many results and words they've probably never really heard before, it can, I think, I would definitely find it overwhelming from their end. Some people don't mind that, but I do know that some people do like to read through it in their own time to kind of understand it. So shall I show the client fact sheet? So you scroll back up to the top. There is the fact sheet here. So if I click on that, and then it's basically explained in a more client-friendly way. So it explains what the thyroid glands are again, what causes it. It explains how common it can be. I think some people get worried that their cat's got something quite rare, but it is not.
Yeah.
And
the way
goes,
the structuring of this, was this helpful,
really helpful
to help the client understand, you know, some of their questions that they were concerned about?
Yeah, they were really grateful. And I think explaining to people about the unmasking of kidney disease becomes quite confusing as well, because I think they think when they're treating the hypothyroid, they're then causing kidney disease when you first tell them that. So having that explained to them as well, and written down, I think helps it make a lot more sense to them as well, because they're not making the kidneys worse. The kidneys are just showing their true colours in the blood results.
So how did you use the this client fact sheets to help with the client? What did you how did you help communicate with them?
So I sent over the sheets.
You printed it off as a PDF? Or?
So with this one, because I was on the phone and I wasn't going to see her until she came back for her repeat blood test, I got to the PDF, which is, if you scroll all the way to the bottom, there we go. So if you go to print, I don't think this is going to come up on the screen share, but that is what you would click, and then it comes up as a PDF. You can attach that to an email, and then send it over, and then they can read it in their own time as well, which is perfect. It also goes through all the different treatments and why you would do each one of them as well, which is very helpful when there are multiple treatments for this disease as well.